So, Daniel, I have your notes here, but I'd like to hear your perspective. Could you start by telling me a bit about your condition, how it started, what treatment you've had, and anything else you feel I should know?
Yeah, well, I've been back and forth to the GP about this diarrhea. I've had it for about a month now. There's streaks of blood, too. Every time. I just have to go, and there's nothing I can do to stop it. It's gross. The other day was the worst. I went more than 15 times. So yeah, the GP's been trying to understand what's been going on, and I've been taking Imodium for it, which isn't helping much. But now I've got this pain in my belly. It's been about a week. It's a cramping pain, yeah? It comes in waves and it doesn't let up. It's low down, on the left.
I see. And is anything else happening that doesn't seem right?
Well, I've lost weight. About 4 kilos. But I guess that's because I'm not bothered about eating. And when I do, I just can't keep it in. When I stand up, I feel lightheaded. I got to take a minute before I do anything in case I faint or something. Actually, there's this general sense of being shattered. It's really hard for me to find any energy. I'm a bit breathless sometimes too, which is weird because I'm not doing anything. I've been off work for 10 days now. I'm a pastry chef in a hotel, and understandably the boss doesn't want me there with the runs.
Have you experienced anything like this before, Daniel?
Well, 2 years ago I was getting some blood in my poop, and I was bloated a lot, so the GP arranged for a scan, a colonoscopy. My dad died of colon cancer, so I think it was to rule it out. So yeah, I got the all clear, and things have been more or less okay until now. I've had gastroenteritis a few times, on holiday, and years ago when I was travelling, and I had something like dysentery, but this feels different.
And have there been any changes to your diet recently? Maybe before these problems began?
That's a stupid thing, really, because I went vegetarian about 6 months ago. My girlfriend's a vegan, and she was always going on at me to clean up my act, but there's no way I could eat the stuff she eats. So I don't eat meat or fish anymore, so there's that, and I'm definitely eating more whole foods and vegetables. I won't eat tofu, that's just asking too much for me, and I avoid things that give me wind. Pulses, I never eat. They have a terrible effect on me. But on the whole, it's a pretty healthy diet. Or was, when I was eating. I drink a lot of coffee, though, and haven't managed to cut that out. I usually drink about 8 cups a day.
That is quite a lot. Are you taking any medication for anything, Daniel?
Well, it's not really medication, but I had a bout of thrush about 4 months ago, and so my girlfriend gave me these herbal things. Anti-candida capsules? I don't know what's in them. Garlic, maybe? I take 1 a day. And I'm taking some paracetamol at the moment, when the pain's bad, Oh, and I get hay fever sometimes, so I have a nasal spray. Don't use it much, though, as and when. I don't take anything else.
Well, Daniel, thank you for all that background. That's really useful. What I'd like to do now is...
So, Evelyn, I have your notes here, but I'd like to hear your perspective. Perhaps you could start by telling me, in your own words, a bit about your condition, how it started, what treatment you've had, and anything else you feel I should know.
Well, I've been getting a lot of pain in my right hip, here. I noticed it first about 6 months ago, and well, initially I didn't think much of it because I only felt it when I was playing golf, which I used to do once a week. Anyway, it got worse and walking started to be really uncomfortable, but it would ease off when I was sitting or resting or whatever. But it's got progressively worse and the pain's there pretty much all the time now.
And how would you describe the pain, Evelyn?
Well, it's always in the same place. I mean, it doesn't move anywhere else. I don't feel it in my knee or further down. In terms of how much pain I'm in, sometimes it's unbearable actually. It reduces me to tears. On that scale of 1 to 10 that you use, I'd say an 8. It's like a burning, My GP gave me a prescription for painkillers, which help for a bit, but they're pretty strong and I can't take too many.
And aside from pain relief, have you received any treatment for this?
Well, not really, no. The GP suggested I do some targeted exercise to loosen me up, yoga for tight hips. I was doing that at home. She also said swimming could help, so I took a few classes of aquagym, but I lasted 2 weeks, I think. I hate leisure centres. I prefer to be outside in the fresh air. And because there was no improvement, the GP suggested some sports massage. I did 6 sessions, and I'd still be doing it if I could afford to. I'd been really tense, I think, so it helped me relax. I think the idea was that my job might have been a contributing factor. I'm a garden designer, and I've spent 30 years on my feet, standing awkwardly, lugging heavy plants, and twisting myself into weird shapes.
You say you've not experienced anything like this before. Have you had any past injuries or accidents, Evelyn?
No, I've never felt anything like this, and I can't think what I might have done to bring this on. I should say I had an X-ray straight away, but apparently it didn't show anything, so that was that. The last time I had an X-ray was when I was 14 and I fell off a horse. I used to ride a lot in those days. Anyway, I broke my collarbone then, and then last year I had a bit of a bump in the car. Some idiot ran into the back of me at a junction, and that left me with whiplash, but it really wasn't serious.
What about your family? Any health problems?
My mother, well, she had a bit of a scare last year, had an ischemic stroke, but, well, she's taking something now and she's getting back to her usual self. She's 75. My father's 79 and in great health. He's always well, actually, and I just have the one sister, 5 years younger than me. She's recently been diagnosed with rheumatoid arthritis, actually, which may or may not be relevant.
Well, Evelyn, thank you for all that background. That's really useful. What I'd like to do now is...
So, what's the situation with Mr. Blakemore?
Well, he hasn't brought any blood results with him, and he doesn't seem to know if any were done at the practice when he was referred. I've told him that we may not be able to go ahead without them, and he's not taking it too well. He's saying it wasn't a problem before, and he's here about his heart, not his kidneys. He's pretty annoyed.
I can imagine he is. I would be too. Can you get reception to give the practice a call? If they've been done and can be sent over, that solves everyone's problems. The fact is, I can't go ahead with the exam in a man his age without them. He was under the age threshold last time he had an MRI. I'll have a word with him now to explain.
So just to let you know of 5 training dates next month, to introduce the new service, Autism Awareness, that's already up and running in the hospital. The service has 1 specialist nurse full-time, that's Kath Latham, and she'll be running the sessions. Can everyone find a date that's good for them, please? Anyone who can't attend any of these, let me know. I'm encouraging all staff, clinical and administrative, regardless of their role, to attend. Everyone is likely to have some interaction with someone on the autistic spectrum during their career, and irrespective of where they are on the spectrum, they'll need everyone they come into contact with here at the hospital to have an understanding of the challenges that they may be facing. Hospital can be a very daunting place. So we're going to go ahead and start the patient on NIV.
Okay, right. Does she know?
I've just had a chat. She knows what it is because she was on it when she was last in, but she had a pretty poor experience from what I can make out. She said she felt claustrophobic and the mask was on too tight. So I've told her why that's necessary and how she might feel initially, and that we'll be monitoring her continually. She's come round to it now, but when you size up, can you reiterate why we need a snug fit? It will make a big difference to her breathing, and she'll have a better time of it.
Right, everyone, let's do the safety brief. Firstly, Mrs. Jenkins is a high falls risk. She's been confused lately and is unsteady on her feet. Keep an eye on her when she's moving about. Mrs. Selby has developed a pressure area on her sacrum. She's reluctant to move much after her operation and is also incontinent. We put her on an alternating pressure mattress yesterday.
Okay.
Next, Mr. Dawson has been moved into an isolation room after some diarrhea and vomiting. Mrs. Brown needs repeat MRSA swabs as she's finished her eradication treatment. That's a priority so she can be discharged.
Sure.
Okay, no other notices. Please sign the safety brief before you start the shift.
So I think Mr. Shah knows he's sick, but I'm not sure he's fully understood just how sick. He's adamant he doesn't want the LVAD, and the message isn't getting through how much he needs it though. I don't get any sense that cognitively there's a problem. He's just been talking to me about investments, but he keeps saying he wants to get back to work. So, I don't know. I've heard from the clinical nursing manager here that he lives alone, has no family locally who could assist him, and his sister is not financially in a position to move closer to be with him. So I'm thinking that might well be what's going on here. But we'll see what he says once the LVAD team have made their decision, though they're not going to be keen to go ahead now, given his position.
So how have you been since the last time we met, Stephen? How have you been getting on with the breathing exercises I showed you?
I've been much the same, love. I did give them a go last month, as it happens, but it's not been an easy time. It's the damp, I suppose. When I'm struggling to get my breath, it's all I can think of. I go into a panic, I suppose, and they go right out of my head. I think I'll have to go through it all again, love. I'm not sure that I don't need my tablets increasing, though. The ones for the mucus. It's been bad this week and it's thicker than before.
No problem, Stephen, but you'll have to speak to the doctor about your prescription. I can update him too so he knows we've chatted about it. ADHD is a disorder that many associate solely with young children. However, as much as 4% of the adult population is estimated to have ADHD, and not all of these people were diagnosed in childhood. While some disagree, my view is that ADHD cannot be referred to as an adult onset, but rather the condition, which has always been present, becomes more apparent and less easy to hide as people get older. This doesn't mean, however, that diagnosis is straightforward, and sadly, many adults will never be diagnosed. The somewhat stereotypical ADHD child tears around the classroom, climbs the bookcase, and suffers meltdowns in public. So it's hard for some to imagine that the condition can ever remain hidden. But key here are good social environments in childhood, strong family relationships, and a stable school environment, which all contribute to reducing the disruption the disorder can create. Interestingly, unlike many with ADHD diagnosed in childhood, we see many high-functioning, very bright individuals in my clinic. These people could compensate when young by using social adaptation strategies, but as the supportive structures fall away in adulthood, they begin to struggle. A patient of mine, I'll call him James, had a relatively unremarkable childhood, though always had difficulty making friends, and remembers the feeling of just not fitting in. At the beginning of his second year at university and away from the protective environment of his parents, he started to experience panic attacks and episodes of depersonalization, which he described as like being outside of himself, looking in. So convinced was he that these, with their frightening intensity, must have had a physical cause, he'd show up at his GP twice a week with a new ailment that might, he felt, explain what was happening to him. He quit his studies and returned to live with his parents. His anxiety by now was so extreme, he was sleeping on a camp bed in his parents' bedroom. He still remembers the despair he felt about the future and the grief at what he says felt like losing the old James. As GPs, you see a lot of patients who present with anxiety disorders, depression, and addictions. But adult ADHD remains undiagnosed because these common psychiatric disturbances not only mask the symptoms but often coexist with ADHD. For a decade, James's doctors felt that anxiety was the sole issue, and an assessment for ADHD was never suggested. Rather, he was prescribed one antidepressant after another, along with beta blockers and tranquilizers. He was a regular visitor to his GP to ask for his treatment to be changed, as he saw no improvement, and meanwhile his life was falling apart. Divorce, a drink-driving conviction, debt, depression, and bouts of unemployment all featured. And like so many conditions, ADHD manifests differently in the sexes. Katie, another of my patients, told me she'd been a quiet child, would fidget constantly and would daydream, but had never been hyperactive or had any behavioural problems, these being far more frequently seen in boys. And while she was unwilling to accept the diagnosis at first, feeling ashamed to have a condition that she associated with disruptive, unruly boys, as she learned more about it, it became, she says, like the missing piece of the puzzle. It's not surprising that some patients feel as Katie first did, as there's a prevailing scepticism about the condition, even among GPs and psychiatrists. But it is vital that if we accept the existence of ADHD in adults, and I believe there is more than enough evidence of its existence, then we must also address the lack of awareness that exists within our society and do what we can as medical professionals to make sure that undiagnosed adults are not left to live dysfunctional lives.
Good morning, Dr. Singh. Thank you for talking to us today. The first question is an obvious one. What exactly is a group consultation?
Hello. Well, a group consultation is pretty much as it sounds. A group of patients with the same condition, a dozen or so, come together for a shared appointment delivered by a clinician. These consultations, and this does cause some concern for patients at first, are not in addition to the traditional one-on-one consultation. They replace it. We don't make anyone attend, of course, but we do invite them to. Both newly diagnosed patients and those who have lived with the condition for a while are included. They last up to an hour, which is much longer than patients are used to a consultation lasting.
I see. So what prompted this initiative?
Well, our practice covers a large area, and the prevalence of diagnosed diabetes 2 cases is 8%. Nationally, it's 6%, and in a few places in our catchment area, it's as high as 12%. So our GPs were finding that many of the patients that they saw on a daily basis had a lot in common and needed similar advice and guidance. This meant that the GP would be saying more or less the same thing on a number of occasions throughout the day.
So this initiative was set up to benefit the practice?
Well, we've seen released data that indicated the control of some of our patients' diabetes was far less effective than similar patients elsewhere in the country. It was really quite marked in some cases. They'd looked at parameters like blood glucose, blood pressure, cholesterol, and such. There was clearly something that we GPs needed to do to improve the situation and the information take-up.
And how do patients perceive these sessions?
The feedback we've had so far is overwhelmingly positive. Patients say they're getting more information than before, and they find that information useful. I think the brevity of the traditional consultation doesn't encourage patients to ask questions, but the informality of the group, the fact that everyone's in the same boat and there's nothing to be ashamed of. And many admit to feeling this when first diagnosed, which I hadn't really considered before. All help to encourage people to ask questions. Even if you don't ask a question, someone else does, and you get the benefit from the answer.
So, are group consultations a success?
They are, and in ways we hadn't really expected. This area is ethnically diverse, and we didn't know how this kind of approach would work. But it's been a bit of a bonus because we're also aware of a significant gap in services for the South Asian population, where diabetes 2 is particularly prevalent, and these group consultations are very well received in this demographic. Overall, our GPs and practice nurses have thoroughly enjoyed delivering these sessions, and both report being able to discuss important issues that they don't normally get around to in consultations.
Do you have any advice for other GP practices looking to set up something similar?
Well, the most important thing, I think, is to appreciate that it's not going to suit every clinician. As a health professional in these consultations, you're the resource, but the patients are in the driving seat, not you. When you arrive, they've already decided what they want to know, and they trust you're going to tell them. Aside from that, I think you need to have a well-defined aim. What do you want to change? Who do you want to target? Then sit in on some of the sessions run by other practices so you get a feel for how they are. We're always pleased to welcome interested colleagues.